Hello everyone and welcome back to our channel. Today we are going to be talking extensively on Nigerian healthcare system analysis. When we talk about healthcare, we often think about we often think about hospitals, doctors and medicine, but in many countries, especially in parts of Africa, healthcare is not just about access. It's about survival. Today we are diving into one of the Africa's most populous and vibrant nations, Nigeria, to explore a healthcare system that's both full of potential and plagued by deep-rooted problems. A snapshot of Nigeria's healthcare system. Nigeria is the most populous country in Africa with over 220 million people. You would think that such a large population will mean a robust and efficient healthcare system, but unfortunately, that's far from the case. The healthcare system in Nigeria is split into three tiers. Primary care, the first point of contact, usually handled at the local government level. The secondary care, offered in general hospitals managed by the state governments. Tertiary care, handled in teaching hospitals and federal medical centers, often tied to universities. Sounds organized, right? On paper, yes, but in practice, things fall apart quickly. The problems. Let's break down the core problems that plague Nigeria's healthcare system. S- Spoiler alert, it's not just one issue, it's a web of them. Underfunding. 1. Nigeria allocates less than 5% of its national budget to health. That's far below the 15% benchmark set by the African Union's Abuja Declaration. This means fewer hospitals, limited equipment, and inadequate medications. 2. Brain drain. Every year, thousands of Nigerians, doctors, and nurses leave the country. Why? Low salaries, poor working conditions, and lack of career growth. It's estimated that over 11,000 Nigerian doctors are currently practicing in UK alone. 3. Poor infrastructure. Many hospitals lack basic amenities, no electricity, no running water, outdated medical equipment. Some facilities still rely on paper records and operate without essential diagnostic tools. 4. Corruption and mismanagement. Funds meant for healthcare often disappear through mismanagement or outright corruption. Projects are launched and abandoned while ghost workers inflate payrolls. 5. Access issues. Rural areas where most Nigerians live have little or no access to quality healthcare. People often walk miles to nearest clinic only to find no doctor there. 6. Health insurance. What's that? Only around 3% to 5% of Nigerians have health insurance. The majority pay out of pocket, leading to medical poverty, a situation where people fall into debt due to health expenses. What's missing? So, what exactly is Nigerian healthcare system lacking? 1. Human resources. There's a major shortage of skilled professionals. WHO recommends one doctor per 600 people. Nigeria has about one per 5,000. 2. Technology and innovation. Digital health solutions are rare. Telemedicine barely scratched the surface. Electronic medical records, a dream in many regions. 3. Emergency services. There is no nationwide efficient emergency medical response system. In emergencies, people often rely on commercial vehicles or family members to get to the hospital. 4. Pharmaceutical manufacturing. Nigeria heavily depends on imported drugs. This drives up prices and makes the country vulnerable to supply chain shocks. 5. Public trust. After decades of disappointment, many Nigerians no longer trust public hospitals. Those who can afford it opt for private clinics or even medical tourism abroad. Is there hope? Despite all the challenges, not all hope is lost. Solutions exist and some are already in motion. 1. Increased funding. The government must prioritize health in its budget. It's not just a moral issue. Healthy citizens are found of a strong economy. Two, strengthen primary care. Investing in primary care centers can reduce the burden of tertiary hospitals. Think vacations, maternal health, malaria treatment, all done locally. Three, incentive doctors to stay. Better pay, improved working conditions, and continuing education can encourage doctors and nurses to stay and serve. Four, leverage technology. Mobile health apps, telemedicine platforms, and AI diagnostics can bridge gap, especially in rural areas. 5. Universal health coverage. Expanding the National Health Insurance Scheme (NHIS) is essential. More people need access to care without going broke. 6. Partner with the private sector. Public-private partnerships can bring innovation, investments, and expertise to the system faster than the government can alone. 7. Anti-corruption reforms. Transparent procurement processes, digital payroll systems, and independent auditing can help reduce wastage and fraud. Nigeria's healthcare system is standing at a crossroads. The challenges are enormous, but so is the potential. With the right investments, smart policies, and collective will, Nigeria could transform from a nation struggling to care for its people to a global example of health innovation and resilience. If you found this video insightful, hit the like button, subscribe for more in-depth stories, and let us know in the comments what do you think is the most urgent fix for Nigeria's healthcare.